Hi, my name is Dan and I'm an anesthesiologist, hence the channel name. Normally I talk about surgery or how anesthesia works, or about terrifying historical diseases that make body parts fall off. See the link in the description. But today I'm doing something a little different. I'm going to show you my top 10 weirdly useful medical life hacks that most people never learn, even though they make everyday life a lot easier. These are the kinds of little tricks that doctors, nurses, paramedics, and patients quietly discover over time that make you go, wait, why didn't anybody tell me this sooner? So here are 10 surprisingly useful medical life hacks, explained with actual anatomy and physiology, because apparently I'm incapable of not turning everything into a mini science lesson. I don't know why, just go with it. Few things escalate emotionally faster than realizing that your ring is no longer jewelry, but has become a permanent part of your hand. Most people immediately start pulling harder and harder, which actually makes the swelling worse. Your finger gets irritated, fluid builds up, blood flow gets restricted, and suddenly your wedding ring has entered the tourniquet phase of appendage death. So instead of trying to force it off, try using warm water first. This sounds backwards because people assume that cold water is what shrinks swelling, but warm water actually helps relax the soft tissues and makes the skin more flexible and slippery. So try soaking your finger in warm water for a few minutes. Then add soap, lotion, or oil, and instead of yanking outward, slowly twist the ring while gently walking it forward just a tiny bit at a time. The twisting is really key because it reduces friction. If your finger's really swollen, hold your hand above your heart for a few minutes first to let some fluid drain out before trying again. If your finger becomes blue, numb, or extremely painful though, stop trying to be a DIY surgeon and go get it removed professionally. Like now. You know those adhesive bandages shaped like a little H that just seem medically unnecessary? Well, they're actually pretty brilliant. Normal bandages tend to peel off joints because your skin constantly bends and stretches. Knuckles are especially bad because pretty much every time you use your hand, the skin folds and pulls at the adhesive. The H-shaped design of this bandage solves this by using 4 flexible flaps instead of one rigid strip. Here's how to apply them properly. First, remove just one side of the protective paper covering. Then place the padded center directly over the knuckle, making sure the flaps are perpendicular to your finger, and press down the 2 exposed flaps so they stick well. Then remove the rest of the paper backing and press the other 2 flaps down. I like to then squeeze everything down tightly with my other hand like this. Using little flaps instead of one big rectangle of fabric lets the bandage flex with the movement of the joint instead of fighting against it. Basically, it turns the bandage into tiny finger engineering, which is way more sophistication than most people expect from something sitting right next to the gum at your pharmacy. This next one is one of the simplest physiology tricks ever, and it works surprisingly well. If you struggle with acid reflux, sleeping on your left side is usually better than sleeping on your right side. The reason comes down to anatomy and gravity. Your stomach is shaped kind of like a curved pouch, and when you lie on your right side, stomach acid sits closer to the connection between the stomach and the esophagus. That makes it easier for acid to reflux upward. But when you lie on your left side, the position of the stomach helps keep acid lower and farther away from the esophagus. So gravity starts working for you instead of against you. This doesn't cure acid reflux disease, obviously, but for some people it dramatically reduces nighttime symptoms. That means fewer midnight wake-ups feeling like you drank battery acid for dinner. Most people who use an inhaler like this to help them breathe actually waste a huge portion of the medicine inside it. The most common mistake people make? They don't exhale first. People tend to just do this. Puff, tiny little breath in. That basically just makes the medicine hit the back of the throat and give up on life. Instead, before pushing the button, exhale as much as you comfortably can. This pushes out most of the air in your lungs and creates room for the medicine to travel deeper into the airways when you inhale. So, exhale as much as you can, hold down the button, and inhale slowly. Only release the button when you're finished inhaling. Keep in mind that slow inhalation matters too. If you inhale too quickly, the particles just slam into the upper airway instead of reaching the smaller bronchial passages where they're actually needed, which means technically you're giving your throat really great asthma treatment, but your throat doesn't have asthma. A lot of people try checking their pulse using their thumb, which is unfortunate because your thumb has a pretty strong pulse of its own. So sometimes you're basically just feeling your thumb judging you. Instead, use your index and middle fingers together. The easiest spot to find your pulse is the radial artery, which runs along the thumb side of your wrist and forearm. Not the pinky side, not directly in the center, but off-center on the thumb side. Start out using gentle pressure, because if you press too hard, you can actually squash the artery and accidentally erase the pulse you're trying to feel. But if you can't feel it with gentle pressure, try pushing downward a tiny bit at a time. Sometimes the artery can be pretty deep and you have to fish for it. Once you find it, count the number of beats for 15 seconds, then multiply by 4 to get your heart rate. Congratulations, you're now doing low-budget cardiology. Most people push foam earplugs straight inward, like they're loading ammunition into their skull. The problem is that the outer ear canal is not a straight horizontal tunnel. It actually angles slightly forward and upward. So here's the trick. Roll the foam earplugs into a tight cylinder first, then try aiming it forward and upward toward the eyebrow on the other side of your head. Sometimes that's all you need to push it right in. But if you're still having trouble inserting it, then reach over your head with the opposite hand and gently pull the top of your ear upward and backward. That movement helps to straighten out the ear canal. Then try inserting the earplug again and holding it in place for a few seconds while the foam expands. This is how professionals working around aircraft, power tools, and loud machinery can get those things seated so deeply and comfortably. They're not just shoving harder, they're working with the geometry of the human head instead of against it. Okay, this one sounds fake, but it's actually real. Sometimes humming can temporarily improve sinus drainage pressure. Not because of mystical space frequencies or whatever your crazy aunt posts about on Facebook, but because humming causes the air in your nose to rapidly oscillate back and forth. Your sinuses are basically dead-end caves in your facial bones, and there's only one way in or out. If that entrance gets blocked by mucus, then infections can take hold inside the caves. By humming, you're causing the mucus in those little cave entrances to vibrate, allowing air to flow in and out temporarily. The way scientists figured this out is actually pretty cool. They knew that the tissue inside the sinuses produces a gas called nitric oxide, so they measured nitric oxide in the noses of volunteers with stuffy sinuses. When they just breathed normally, there was basically no nitric oxide in the nasal passages. But when they asked the volunteers to hum, nitric oxide levels increased 15-fold, indicating that air was moving in and out of the sinuses. I'll leave a link to that study in the description in case you want to read more about it. But that's why some people notice mild sinus relief after humming for just a minute or two. And yes, this means your body has a built-in feature where aggressively humming, like an old refrigerator, can technically improve airflow. Human biology is amazing. But just to be clear, this isn't curing sinus infections or replacing actual medical treatment. It's just a little bit of help for mild congestion or pressure. If you have a sinus infection, you should go see your doctor. If you wear glasses and a mask at the same time, you already know the struggle. You walk into a grocery store and instantly become legally blind. The reason this happens is actually pretty simple. Warm, moist air from your breath escapes upward through the gap near your nose, hits the colder lenses, and condenses into tiny droplets. Basically, it's like a weather pattern on your face. The solution is to stop air from escaping upward out of the mask in the first place. The easiest method is to position the mask slightly higher on the bridge of your nose and pinch the metal nose strip firmly so it conforms to your face. But here's the trick most people don't know. If you place your glasses slightly over the top edge of the mask, the nose pads can help seal the fabric down and block the airflow. You can also place a folded tissue inside the top edge of the mask to absorb moisture and reduce the escaping air. In hospitals, some people even use medical tape across the bridge of the nose for a complete seal. That works amazingly well, but also makes you look like you're either performing surgery or robbing a bank, just FYI. Have you ever noticed that when your nose gets clogged, it's almost always worse on one side? That's because your nose actually runs on a natural cycle where congestion shifts back and forth between nostrils throughout the day. Which sounds totally fake, but it's actually true. Your nose has scheduled lane closures. But here's the trick. If one nostril is clogged, lie on the opposite side of your body for a few minutes. So if your left nostril is blocked, try lying down on your right side. Why? Well, because gravity helps drain away some of the fluids pooling in the swollen tissues inside the upper nostril, which can temporarily improve airflow. You can also try sitting up and leaning slightly forward. This can also let gravity help drain some of the gunk from your nose. Just be sure to wear a bib, or at least do it outside, you animal. Okay, this one's my favorite because it just works so well. Hiccups are basically tiny spasms of the diaphragm, the muscle that helps you breathe. And once they start, the nervous system can get stuck in a weird, feedback loop. That's why most hiccup remedies are aimed at trying to interrupt that loop somehow. But the best method I've ever seen used is slowly drinking water continuously without pausing for as long as you can. Not chugging or trying to swallow an entire glass all at once like you did with beers in college. I mean slow, steady, constant swallowing. Why does this help? Because your body's breathing system has been evolving over millions and millions of years to ensure that you don't try to take a breath while you're swallowing food or drink. All the animals whose nervous systems didn't do that aren't here anymore. So the longer you can slowly swallow water over and over again without stopping, the longer the diaphragm gets the message to stop trying to take a breath, which can help to reset that feedback loop we talked about. Some people also accidentally hold their breath while drinking slowly, which changes carbon dioxide levels slightly and may contribute to stopping the hiccups. The important thing is that you're interrupting the rhythm of the muscle spasms. Just think about how many humans have suffered through days and weeks of hiccups throughout history because they didn't know what you know now. All you need to do is gently coax your diaphragm back into behaving by drinking a glass of water really slowly. So there you have it. Those are my top 10 medical life hacks that are surprisingly useful once you understand the anatomy behind them. Medicine is full of these tiny little tricks where understanding how the body works suddenly makes everyday problems easier to solve. If you enjoyed this video, let me know in the comments and I'll make a part 2 because honestly I have a disturbing number of these in my head. And if you'd like to see more videos where I explain medical phenomena, anesthesia, surgery, and the horrifying ways the human body can malfunction, make sure to subscribe. Thanks for watching and I'll see you in the next one.